Okay. It's me, Slimmy V. Let's get down and dirty on this COVID situation. I know. Look, right now, this is the popular thing that's going on in the media right now. And the type of narrative that is being pushed by the mainstream is not exactly what we should be hearing. These are the type of things that we should be looking out for. Okay. Um, Kids gained lots of weight in 2020 during the lockdowns. How much weight? You are going to see. How does this affect them? Well, if you are aware that, okay, I am gonna go and show you this. The CDC study finds that about 78% of people hospitalized for COVID were overweight or obese. This was in March of 2021. March 8th, 2021, and updated on March 9th, 2021. 78% of people hospitalized for COVID were overweight or obese. All right, now they was looking at the overall people. Right now, we are focusing on children, our kids that we shut out of the world. We let lock down and stayed inside of our homes, doing nothing, not going to the playgrounds because they feared for their lives, not going to school and mingling with other children because we feared for our lives, not going to church and praising God because we feared for our lives, not doing anything but staying home, watching TV, and playing video games day and night because we feared for our life. Right now, I found this clip, and I'm gonna play a clip. I want you to listen closely and listen intently. Listen to what he is saying. These are studies that have been done. The data have been taken out, and you're gonna get something that is very alarming. Listen.
Why are we going to talk about children? Because this new report found that the prevalence of overweight and obesity, as a result of our own interventions to keep kids safe and to keep people safe, led to a dramatic increase in the prevalence of overweight and obesity. We're talking a 23.9% increase in prevalence, tracking, again, same time periods, pre-pandemic to post-pandemic. Now that is huge because we know that children, especially, and by the way, the children that got disproportionately impacted, the age group of those kids were between the ages of 5 and 11. And so we're going to talk about the importance of this and talk about our disproportionate responses. Where's the outrage now that tens of millions of children are now more obese or more overweight than they were before? Now, why should we have outrage for the dramatic increase in obesity and overweight? Well, we know there's complications, long haul complications linked with being overweight or obese. We're talking about depression. We're talking about social stigma. We're talking about being teased. We're talking about increasing the risk for diseases that are deadly, like heart disease, like cancer, like mild cognitive impairment and Alzheimer's, like chronic inflammatory disorders, like asthma, okay? The more overweight you are, the increased risk of asthma you have. We know that asthmatics suffer from more severe COVID-19, right? Autoimmunity. Obese people are more likely to suffer from autoimmune diseases. Now, we also know, of course, this has been long known, that obesity is linked with severe COVID-19 complications in adults and, wait for it, in children as well. So I ask you, my friends, as I share this data, in the Journal of the American Medical Association, the title of the paper is Changes in Body Mass Index Amongst Children and Adolescents During the COVID-19 Pandemic. Now, just a little background. Hey, we're going to get into this. We're going to talk about viral variants and how obese individuals might be driving future viral variants. We're going to talk about the immunopathology of obesity.
So now that you've heard everything that he said, I am not going to play this entire clip. It's actually 24 minutes. I am going to post this in the description below so you can watch this full thing for yourself. He did not even mention the rise in kids being diabetic. He did not even mention the rise in kids suffering from hypertension. Okay? And then he did say there's a link to that, and he laid it out real smoothly, intellectually, with data and facts and publications to back up what he's saying. in this video. He backs it up as to where the other variants are coming from and how the other variants are actually emerging. Again, before I even go through this, I want to say I am not saying the vaccines don't work. I'm not saying that they do work. I am simply saying go see your doctor. They know your history. They know you. You know your own body. Make the decisions with your medical professional. Now, I will put that link in the description. Now, let me go to this. All right, I showed this to you a little bit earlier. The CDC studies find that 78% of people hospitalized for COVID were overweight or obese. Okay, let's look at the bullet points. I am also going to put this in a description. I did speak about this early on. About 78% of people who have been hospitalized, needed a ventilator, or died from COVID-19 have been overweight or obese. The Centers for Disease Control and Prevention saw a new study on Monday. This was in back in March of 2021. What he's talking about right now is a study that's being done right now as of September 4th, 2021. All right. Now, let's read this other bullet point. Just over 42% of the U.S. population was considered obese in 2018, according to the agency's most recent statistics. Overweight is defined as having a body mass index of 25 or more, while obesity is defined as having a BMI of 30 or more. The last bullet point, all right, I am going to post this in the description to back what I'm saying. As clinicians develop care plans for COVID-19 patients, they should consider the risk of severe outcomes in patients with higher BMIs, especially for those with severe obesity, the CDC wrote. Which leads you to think, why are they not pushing you to go to the gym and work out? Why are they actually telling you that you need to be vaccinated to enter certain gyms, these certain facilities? Why? This is perplexing. This is ridiculous. This is outrageous. This is stupidity at the highest degree. And for them to keep those who feel that those who feel like they shouldn't be those who feel like they should not be vaxxed, right? They feel like those people should not enter a gym, right? So how does that work? You know, you've done your due diligence by taking your zinc, by taking your vitamin D, by taking your vitamin B, by taking your C complexes, citrus and all of that, working out, and now they're not even talking about those good things that you should be taking. They're not even talking about that you should be focusing on your health should a next variant that might be powerful than the last comes. Like, what are they doing here? You know, so it is really important that you exercise, that you eat your greens, that you eat your bitters, that you keep your body in optimal shape, so that if something else comes along, that your immune system is strong enough to fight it and keep you out of the hospital. Because the leaner you are, the more muscles you have, the more healthier you eat, will keep you out of the hospital, will keep you off the ventilators. This is what I wanted to show you. This is what I wanted to share with you. It's in my heart to either share with you these truths that the mainstream media have not been sharing with you. Pass this video along, share this video, like this video, and subscribe to the channel, because anything I get that will help those that's standing up for their rights, I will not be afraid to share it and to speak on it. It's my opinion. Trust me, I won't do anything to try and get banned. I want to do everything possible to stay on the platform. All right, but as always, if you're not offended, you probably wasn't watching or listening. I'm Slimmy V, and this is the most offensive podcast ever. God bless, stress less, and let Yahweh do the rest. I'm out. Peace.